Welcome back to the Medical Knowledge Quiz Series. This is Level 2, Part 1. Are you ready to think like a doctor? Here we go! A chest CT scan with contrast is administered following a car accident. What do the red and blue arrows indicate respectively? Bone and water, blood and muscle, air and blood. That's air and blood. A blood smear from a patient with cyclical fevers after traveling is shown below. What is the most likely diagnosis? Sickle cell disease, hepatitis B, or malaria? Yup, it's malaria. The nerve roots of the sympathetic nervous system exit the spinal cord in which region? Is it the cervical, thoracic, or lumbar region? Thoracic region. A muscle wasting disease runs in a family, but only seems to affect the males. What is the most likely form of inheritance? X-linked recessive. A patient with pancreatitis has fat malabsorption. Which vitamin deficiencies is this patient at risk of developing? It's A, D, E, and K. In response to acidic blood, what is the appropriate response by the lungs? Increase or decrease the respiration rate, or secrete more mucus? Yeah, let's increase the respiration rate. The breakdown products of which compound in blood cells is responsible for the color of both feces and urine? Pyoverdin, globin, or heme? Yeah, it's heme. A kidney biopsy is taken and observed under the microscope. What is the filtering unit seen at the center of the image? This here is a glomerulus. Shingles is the painful reactivation of the virus that causes which childhood infection? Croup, chickenpox, or measles? Chickenpox. Excessive administration of which of these medications leads to hypoglycemia? Aspirin, furosemide, or insulin? Yes, in fact, it is the insulin. A patient with recurrent infections is found to have a low antibody count, which immune cells produce antibodies. T lymphocytes, plasma cells, or neutrophils? It's the plasma cells. Bacteria are broadly classified into gram-positive and gram-negative based on differences in their what? The nucleus, cell wall, or mitochondria? The cell wall. A medication with which mechanism would be most helpful to treat asthma? Breakdown of fibrin clots, inhibition of cholesterol synthesis, or bronchial smooth muscle relaxation? It should relax the smooth muscles in the airway. A basketball player injures their anterior talofibular ligament during a game. What was the likely cause? Twisting of the knee, fall on an outstretched hand, or a rolled ankle? This is from a rolled ankle. Lastly, a patient is brought to the emergency room with a racing heart and dilated pupils. Which drug is most likely to cause this condition? Heroin, fentanyl, or cocaine? Cocaine toxicity can do this. So how did you do? Let me know in the comments below and subscribe for more.